we have a form that we need to fill out. We're going to talk about what I think of as more of the fun stuff. So we're going to talk about our systems and our timekeeping and payroll and all that fun stuff now. So hopefully this is a little bit more interesting than the first chunk we've gone through already. So this is just a quick representation of all of the systems that I have administrative kind of abilities over. So these are going to be the systems that you'll use day to day when it comes to working with patients here at Pacific Point and tracking your time and being compliant with all of our internal company policies. So Kinzer WellSky, that's our medical record system. That's where all the patient charting will occur. If you are a per diem person or getting paid per visit, this will be your primary way of tracking your time. It's going to be part of your charting that you do. Your documentation in Kinzer is going to kind of, in essence, become your timekeeping record. Relias is our learning management system. That's where you'll log in and do trainings online for multiple topics. The main requirements are going to be the emergency management planning, like I talked about earlier, workplace violence prevention, HIPAA privacy control, infection control, bloodborne pathogens, all the main ones, sexual harassment policy. And then, so those be the initial courses assigned to you. There's about, I think it's 6 hours for the initial courses. So it's kind of a lot initially. And then once a month, you'll be assigned a new course, just at 30 minutes. Sometimes they're an hour once a month to kind of keep you fresh, to keep you in the know on all of our annual monthly topics. So keep an eye out for Relias things. I don't require my staff to do the brain sparks. You might get some additional emails from Relias with like little quizzes and things. You're more than welcome to do them, but I am not going to give you any extra points for doing them. So just complete the basic courses that I have assigned. That's all I ask. And another note about Relias, those of you that are credentialed with, a license, a medical license, you can also log into Relias and take like kind of self-enroll in courses that are continuing education credits that will count towards your license renewal. So if you're coming up due for renewal, you certainly can self-enroll in those courses. Alrighty, then we've got Microsoft 365. That's where we keep track of all the ways we talk to each other. We've got email, we got Teams. I use SharePoint a fair amount here in the office, Excel, Word, and PowerPoint. Those of you out in the field, it's going to be mainly Teams and Outlook. Those are the two apps that you're going to want to use to stay in communication with your team here in the office and with your fellow clinicians. And we got Paycom on the roster now for HR and payroll. We'll talk a lot about Paycom in a few minutes here. It's a fun new program that I'm excited to have. We just started using it in January, so it's still a little bit new to me. And then anyone who is joining the team is going to be full-time. Ease is the platform that we use for our health insurance enrollment. So I don't think anyone who's going to be listening in on this video recording is full-time, so we won't talk about Ease too much. But if you do become full-time at some point in the future, that's just a good note to have in your head that it's through Ease. That's the company that we use to enroll. Okay, so our human resources processes. Paycom is where I keep track of all of your records. Everything in there is, your demographics about you, your address, phone number, your tax information, your compliance documents, all of your TB, CPR, auto insurance, all the things that expire. I keep track of that all in Paycom. So you've just uploaded a lot of those documents for me. Thank you so much for doing that. And then I have set up auto email kind of reminders from Paycom to let you know when it's time to renew something, or if something's coming up to be expiring soon, I'll send you a 30-day notice, a 15-day notice, and a 7-day notice. Not trying to be pesky, but just trying to make sure that we stay compliant. It's important that I am pestering you to get those things so that we can have a good grade when we do have our survey. That's always my goal, not to bother you, but always to be perfectly in compliance. So I appreciate your quick response to those emails in advance. You can also view your pay stubs and W-2s in Paycom. You also can do a lot of self-service things there, change your address, change your phone number, change your taxes, alter your direct deposit information if you need to. And then those of you who are on this recording, you will have some amount of need to put in some things into Paycom for extra pay for non-clinical tasks. So like we'll talk about that in a minute, but that is where you will put anything that isn't able to be recorded in Kinzer when it comes to tracking your time. You'll put it into Paycom. Just a quick note on the expiring documents, like your credentials here, TB, CPR, auto insurance, driver's license, and your licensure. The policy is if any of these things do expire while you are employed with us, I need to direct Bianca and the team to pull you from the field. You are not able to see patients if you have an expired TB or CPR or professional license, whether that's your nursing license or your therapy license. I know you don't intend to let those things expire, but just know that that is a consequence of not taking care of the paperwork side of things. If you get busy and you aren't able to keep up with that, that will be the consequences. I'll have to pull you from the field, and I don't like having to do that. So please try to stay on top of the requests that go out for those expiring documents. This is just a little representation of all the things that I'm keeping tabs on in your file. So nothing really to worry about here, but just a lot of different elements that I have to make sure that we have filed in your records and that we keep and maintain as they expire. Righty, so we do performance evaluations here at Pacific Point we'll do it at a 90-day interval. So those of you who are joining us this week, 1st of April, you'll have your 90-day review in early July. And then we will also do an annual performance evaluation in April every year for you. So that is the cadence. We like to review, just the job description, the elements of the job description, and just give you a quick rating on how you're doing, give you some notes if there's things that you can do to improve. You might be getting an A+, and that's awesome, but there's always something that you can do even better. So please be open to any feedback and be willing to consider, there might be a better way or there might be a faster way or whatever it is. When you are a clinician, you have to do a competency assessment before you can see patients on your own. For Pacific Point, we need to do those competency assessments and hand hygiene assessments first. And then after that's completed, we will do a competency assessment every 3 years. And then the hand hygiene assessment has to be done annually. So we'll have someone go out, watch you wash your hands with a patient, or you can come into the office and do that in a lab setting here. But we have to record that training and that we're verifying that you're having good habits when it comes to the hand hygiene. Okay, timekeeping. This is probably one of the most important pieces of the orientation. So I'm gonna talk slow and make sure that I give you a chance to ask questions if you have any questions. And if you're listening to this in a recording, please feel free to email me or send me a Teams message if you are unsure of what I'm saying or if you just need extra clarification. I'm happy to repeat myself as many times as needed on this because this is important. So our timekeeping is managed through 2 different systems. So the majority of our staff are clinicians who are paid per visit. So you will track that work in Kinzer. When you complete your patient visits, you complete your charting for that patient record. There is a place for you to capture the start time, end time of that visit, as well as the drive time and mileage to that visit. So while you get paid per visit, your offer letter has an established rate per each different visit type. You still need to track the time that goes into that visit because that is what's going to determine your accrual for your sick time. So it is important that you do fill that information out. Those of you who are paid hourly, if you're full-time staff in the office, you will punch in and out in Paycom. And there's an app that you can download on your phone. You can also use the desktop to log in and out of Paycom. This access is restricted to only be able to punch in and out from the Serena Valley IP address if you're an office staff person. If you are a clinician who is getting paid hourly, some of our hospice team falls into this category in the middle here. You're going to log punches in Paycom in addition to logging the start and end time visits in Kinzer and mileage. So you kind of be doing both things. So depending on what your offer letter says and the type of payment that you earn, you're going to either be capturing the majority of your time in Kinzer when you do your charting with your patient records. You'll be clocking in and out of Paycom. If you are an hourly person, straight up hourly person, you'll be clocking in and out. Or if you're a clinician that's getting paid hourly, you'll need to do both. In any case, we really try to not have overtime accumulated. So if you're a clinician working full time, we really want to try to keep your day to 8 hours or less. If you find yourself somehow in a position where you have, 6, 7 visits per day, you're most likely going to be falling into that overtime category. And we'd like to try to balance that out a little bit more, whether that means rescheduling things so that you can spread it out a little bit better through the week, or asking for help, which is where a lot of times our PTAs, our OTAs come into play. Our LVNs can kind of help take some of the burden from those routine visits and spread that load out. We do want to make sure that if you are finding yourself in a situation where you're going to be working more than 8 hours in one day, that you ask before working that overtime. Please request that from your manager before you work it so that we can make a decision to either find someone else who can do that work or know that we are agreeing and are authorizing that overtime to be worked and paid. So if you are an hourly person, I'm going to go through this one quickly because I don't think anyone on this training is going to be straight up hourly, but still it's important for you to hear. So if you're hourly, you're going to be using Paycom. You're going to have the Paycom app. You'll have the timekeeping portion handy. You'll probably use that more than anything else in Paycom. You will punch in and out each day. You got to make sure you take a 30-minute lunch break. Anytime you work more than 6 hours in one day, you must take a 30-minute per diem employees as well, pay per visit. You want to make sure you're reviewing your time card at the end of the pay period, and then use any kind of the Paycom change requests to correct any punches that were missed or punched in error, and then submit those at the end of each pay period. So for an hourly person, I would expect 4 punches per day at least. So you punch in for the day, you punch out for lunch, you punch back in from lunch, and then you punch out at the end of the day. And in some cases, you may have multiple ins and outs if doing personal errands in the afternoon and you punch out to go pick your kids up from school and then bring them home, have dinner, whatever, and then you punch back in later in the evening to do some charting at the end of the night. That's okay. You can have multiple instances of punching in and out. It doesn't have to be all in one block. But we do need to make sure that you're taking at least that 30-minute lunch if you're working a big block of time. Anytime you're working 6 or more hours in a day, you must take a 30-minute unpaid lunch break. For my clinical people who are going to be getting paid per visit, you're going to be, like I said, punching everything into Kinzer. So when you're doing your documentation after your visits are completed, this will all be captured in Kinzer. Your start time, end time of the visit, your travel time, your mileage is going to be tracked in Kinzer. One important thing to note on here, the expectation of getting your clinical notes submitted in Kinzer is to do it the same day as the visit, ideally, or the very next day. In some rare circumstances, 48 hours might need to happen, but we really, really want those charting tasks to be completed as soon as possible after the visits are completed. It just makes everything flow better when we know the visits are done. If you are updating a plan of care, your clinical comrades who are also taking care of that patient will know the frequency and duration of any visits that you're dictating for that patient to have. So everything works better when everyone does their charting the same day. We want to make sure that you know about the commute when it comes to mileage and time for driving to patients. So Pacific Point will not reimburse you for your commute to your first patient or back home from your last patient, unless it is in excess of 25 miles. So if you are driving from your home to your first patient's house and it's 30 miles away from your home, you can chart for that visit. You want to put in the full amount of mileage, the 30 miles, into Kinzer, and our payroll process will subtract that 25 miles from that first visit of the day, and you'll be reimbursed for 5 miles or whatever it is if there's a difference greater than that. Um, at the end of the day, when you leave your last patient and you go home, similar situation. If it's more than 25 miles for you to get home after your last patient of the day, you are entitled to receive the difference. However, there is nowhere for that portion of your travel to be documented in Kinzer. So you will need to put that particular piece of mileage or commute time into Paycom. This is one of those areas that gets really confusing. So I'm happy to repeat this for anyone who needs me to explain it again. I also have a document that I can share with you guys regarding the commute mileage situation. If you're unable to submit clinical notes in Kinzer, please contact your manager for direction. Most of the time, that means that you maybe went to do a visit for a patient, and for whatever reason, that visit isn't going to be billable, whether it's because they started care with another agency we did not know. Maybe the patient decided halfway through the start of care visit that they don't want to have home health care and they ask you to leave. Whatever the situation is, if you aren't able to finish a note or submit a clinical note for work that you did, we don't want you to work for free. You need to put that time into Paycom, and you'll probably be using the Ask Here feature, which I will send you a little note. Actually, I can share with you what that looks like here in just a second, but it's a piece of Paycom where you can put in a request for to be paid for certain things. Anything non-clinical must be put into Paycom using Ask Here tools. There are a few exceptions to that rule. I'm going to kind of say this loudly now. So when you're doing any training in Relias, you do not need to worry about putting that into Paycom. I will put that in automatically for you. When you finish your training courses, I pull a report to see what work was completed throughout the pay period, and I just automatically add that for you. So you do not need to punch in and out for Relias training. Only something like a visit that wasn't able to be completed needs to go into Paycom because there's nowhere else for it to be entered. I won't know about it unless you tell me by putting it into Paycom. And feel free again, like this is a confusing part of the orientation. So I want to make sure that any individual questions that you have, or if you just need me to repeat this, I'm happy to do that. Please send me a Teams note, set up a little quick meeting with me, and we'll talk about it again. And you can ask me all the questions that you have. I'm happy to answer them as many times as I need to. No question is a dumb question when it comes to making sure that you're getting paid correctly. All right. Quickly about meal periods and rest breaks. So there are requirements on this, like I said earlier. So any non-exempt employee, so anyone who's getting paid per visit or paid hourly is considered non-exempt. You're required to take that 30-minute unpaid lunch break if you're working at least a 6-hour shift. That break has to start before the end of your 5th hour. I know this is very tedious. So if you start your day at 8:30 in the morning, you must start your lunch break by 1:30 in the afternoon. If you started at 1:32, you're technically out of compliance, and I need to talk to you about that. So please try to take your lunch breaks on time before the 5th hour of your lunch of your shift. If you're working a per diem capacity and you're seeing multiple patients throughout the day, the way that we'll see your lunch break is we'll just be able to see a space in the time that you chart your visits. So your start time, end time, and drive time are very important when it comes to putting those things into Kinzer so that I can see that you took a lunch break. This is important. I don't want anyone to work through the day and not take a break. That's crazy, you guys. You need to stop and eat. You need to go to the restroom. You need to take a minute for yourselves. I do not expect and do not want any of you to just work straight through your work shift, okay? Please hear that. This is kind of going back to that safety aspect and me wanting to take care of you as your HR person. I don't want that for you. I want you to feel well, and I want you to be at your best so that you can take care of our patients. And that means you need to stop and take a break once in a while, and that's okay. Again, non-exempt employees, if you're punching time in Paycom, there should be at least 4 punches per day if you're working 6 hours or more. So it's in for your shift, out for lunch, back in for lunch, and then out at the end of your shift. And you'll notice in Paycom, it dictates those punches. It gives them names. So if you're making a correction to your punch time card, it'll ask you what type of punch, and this is what it's talking about. What is it, in for your day? Is it out for your day? Or is it part of a lunch punch? So beware of those. And also just know I check those time cards. I try to do it daily, but you will get notices from Paycom if you're missing something. So please try to stay on top of that so that it doesn't add up to a big task at the end of the pay period and then stresses us all out before we have to process payroll. Okay. So clinical documentation policy. So this again goes back to all of my clinicians who are seeing patients. So we really, really got to stay on top of this. We don't want anyone to get behind when it comes to charting. We will have a talk if we notice a trend that you're kind of fallen behind when it comes to completing the visits and then not quite finishing the paperwork. That's a really important part of the job, is to finish the documentation. So when it's time for me to run payroll, in Kinzer, any visits that don't show as submitted or completed status are not going to be paid. So another reason to just get your paperwork done on time is to make sure that you're getting paid for those visits. If you have a visit that was completed within the pay period, but the documentation is not finished, it will not be paid until you finish that paperwork. It will be included in the very next payroll. You don't need to take action outside of that, but just please do your charting. Anything outside of Kinzer, for example, excessive mileage, like if you're having a long extended commute going home from a patient's house, that would be considered extra pay. That needs to be put into Paycom by the 3rd or the 18th of each month in order to be included in the following payday. So those are the cutoff dates. These are pay period dates, again, kind of represented in a different way here. So our pay periods, we get paid twice a month. We get paid on the 25th of the month and the 10th of every month. The 2 pay periods we just kind of take the month and chop it in half. So we got the 1st through the 15th, and the cutoff to submit that extra pay request or any kind of documentation is the 18th of the month in order to have it be paid on the 25th. And then the second payroll or pay period of the month rather is the 16th through the end of the month, whatever date that is. The cutoff to submit stuff for that date is the 3rd in order to be paid on the 10th. So we are right around that time frame right now. I'm about to dive into payroll processes tomorrow. So all my people are getting all their extra pay requests entered and trying to make sure all their T's are crossed and I's are dotted. So that we can have a successful payroll. If the 10th or the 25th happens to fall on a weekend day, you will almost always be paid on the Friday prior. There's a rare situation once every 7 years where Christmas falls on a weekend or a Monday rather, and it's just kind of a mess, but that doesn't happen this year in 2025. So I will always send out a notification if the payday is not going to actually be on the 10th or the 25th to let you guys know what day payday actually will be. And since we have our beautiful Paycom, you guys can view your pay stubs easily in the Paycom app. You'll receive notifications from Paycom to approve your paycheck 2 days before payday. Isn't that crazy? This is a wild new feature that I really like about Paycom. It gives you a chance to look at your paycheck before it's processed, not only so that you can let me know if there's something missing or if you were expecting a different amount, but you know what your amount is, and you can plan and you can prepare and you can just take control of your data, which is kind of awesome. So you'll get that notification about 2 days prior to payday. And I'd love for everybody to approve their paychecks for me so that I have 100% confidence that the paychecks are correct. But if you do have a question or concern during that approval process, you can send me an Ask Here request, or you can send me a Teams and let me know if there's something that I missed, or if you have a question I can answer for you. So everyone should download the Paycom app. Make sure you can see your pay stubs and look at your W-2s. It's also where you will put in time off requests for sick time and vacation time. So those of you who are listening to this call are all going to be part-time per diem staff who does not accrue vacation time, but you are all eligible to accrue sick time. So please know that, and please be aware that it is there. It's accruing. And you can use that after you've achieved your 90-day milestone. So in the second week of July, you'll be eligible to use any sick time that you have accrued. Please do request that in Paycom. Also, we want to make sure that Bianca or Olivia knows if you're going to be off work. So please, as a courtesy to them, as your coordinators, scheduling coordinators, let your respective scheduler know if you've got time off planned. If it's not sick time, if you're taking a vacation or if you've got an appointment or something that you need to be off for, please put in a time off request in Paycom as well. It would be an unpaid time off request for everyone on this call, but it's still really important for us to know if you will not be available to see patients so that we can be respectful of your time. Bianca and Olivia won't pester you or bother you if you've got time off noted in the system. Also, it's good for us to know so that we can prepare and plan. So if we need to have someone else see a patient for you, we can work on that ahead of time and not find out about it at the last second. Ideally, all those time off requests would be submitted at least 2 weeks before the actual date that you are trying to be off work. All righty. Whew. I think we got it all, guys. To kind of provide evidence that we did this orientation together. So because this is in a remote setting, I'm going to fill out this form with your name, and I'll tick these boxes off and put my name in this column here for the orientation was completed by me. And then I'll send this to you electronically to put your initials and sign off that we completed all of these elements of your new hire orientation. Getting a badge is going to be important. All of these elements here we talked about already. And then this second and third and fourth pages are going to be specific to clinical orientation. So you may have that part completed by a different person. So Justin, yours will be completed by Tom Spalding. My nurses who are joining us, you'll have yours completed by either Lana or Heidi or Kelly Horn, or even maybe Olivia for some portions. So it'll be a team effort to get all of these boxes ticked off. And if you're joining the team on the home health side, the hospice portion will be not applicable. So we'll just mark through that. But at the end, we'll have everyone sign here. And then the most important thing is that this sheet gets back to me in HR, and I can file that in your employee file, because that's our evidence that we did this training today, and I want you to get credit. So I will make sure that it goes into your file so that when we have our survey, we can get an A+, which is always but yeah, just really happy to have you guys all on the team. Thanks for listening to me talk so much. I'm sorry I'm drowning on and on and on, but I am really happy to have you all on the team, and I can't wait to meet you in person and give you a nice warm handshake and get you your badge and chat with you about any specific questions that you have as you become an awesome new Pacific Point employee. Yay!